Hi, welcome everyone to the AACPDM Community Council Youth Panel. I'm so glad that everyone is here today. Thank you so much to all of our speakers and to everyone tuning in online. I'm really looking forward to today and hearing all of your different viewpoints and how each of your unique perspectives can contribute to this panel. So thankful that you're here. Today's panel will be focusing on issues that youth with CP face, those specific challenges, and then how to overcome those challenges. So we have two people today with lived experience, myself included. Unfortunately, one of our speakers, Denise Nod, had a loss in her family and cannot make it today. So our condolences and prayers go out to her and her family. But we also have clinical perspectives here today. So I'm really looking forward to how these mixed viewpoints can contribute, and just hoping that you will get something beneficial out of today as you listen. Today we'll be focusing on bullying and friendships, body image and career path, and passions. So I will go ahead and introduce myself, and then I'll have my co-moderator, Lynn Fogel, introduce herself, and then I'll have our speakers introduce themselves. So my name is Meredith Schauber, and I'm from Grapevine, Texas. I was born and raised in Texas. I'm the youngest of three. I attended Abilene Christian University and graduated with my nursing degree in 2020. And I was born at 25 weeks, and I have a diagnosis of mild CP and spastic dystonia that primarily affects the right side of my body. But fortunately, I've not let these challenges define me and have just learned to encourage others through my story and find strength in my weakness. So I'm looking forward to sharing my story with you guys today. And I will let Lynn go ahead and introduce herself for me.
Thanks, Meredith. I'm so excited to be working with Meredith on this panel. She's done a super wonderful job pulling it all together. It was her vision, and I've been so excited to support her on making this happen. My name is Lynn Fogel. I live in Columbus, Ohio. I am the parent of a young woman with cerebral palsy. My daughter, Erica, is 20. She has spastic quadriplegic CP. She drives her own motorized wheelchair around. She has a great sense of humor. She's about to finish her transition program post high school. And so we're looking at what's next for her and what a meaningful adult life will look like for her. My background is I am a librarian, and I love bringing information to people that they need. And so I have found a lot of rewarding benefits from being a part of the community council, and I've been honored to chair the council this year.
Awesome. Well, Lynn, if you could go ahead and introduce our speakers for us.
Sure. Let's start out with Emily and have her introduce herself.
Yes, so my name is Emily. I'm 25 years old. I live in Wichita Falls, Texas. I went to school in Abilene, Texas, at Abilene High School, and I graduated with my psychology degree from Midwestern State University here in Wichita Falls, and now I'm just currently recovering from a foot surgery. So I hope that all clears up, and I'll get to pursue my master's soon. So yeah, I'm happy to be here.
Thanks, Emily. How about Beverly?
Hello there, I'm Beverly. I'm now in Chicago, Illinois. Kind of get that I'm not originally from here. I'm from Oxford, England, where I was there for like elementary school. I then actually lived in, excuse me, Israel for 13 years, where I went to the army, finished high school, not in that order, obviously, and then went to Hebrew University, where I got my nursing degree. And I'm now in Chicago, Illinois, and it was totally serendipitous how I ended up at the Shirley Ryan Ability Lab. And it's been a pleasure and a privilege for all the years that I've been here to work with such wonderful people, from the staff to the patients to the kids, which are just amazing. And I'm really excited to be part of this panel. So looking forward to this.
Wonderful. Thank you so much. How about Dr. Kim?
Hello, my name is Haekyung Kim. I originally came from Korea, but currently I'm living in Dallas. I just moved my job from New York City to Dallas. So I'm currently working at University of Texas, Southwestern, and where I am working as a rehabilitation doctor, but also I'm running the department. I'm so glad to be a member of the panel, because I don't know what I'm going to talk about it, but I'm crazy about CP, cerebral palsy. That's why I went to medical school, and I always wanted to do something, but I don't know what I'm doing. But being in Dallas, I think I have a lot of opportunity to work for adults with the cerebral palsy, along with the pediatric cerebral palsy. And originally, as I said, originally I was working as a pediatric rehabilitation doctor, but currently I have to combine the adult and pediatrics. So I have more opportunity to work for people with the cerebral palsy in my community, for people with this or family with the cerebral palsy. And then just talking about myself is as you can see, I have a very cute accent, and then I'm very funny. So I always telling people that my parents were very upset that I become a doctor rather than being comedian. So, so today I think we're gonna have fun. So very nice meeting you all. And then I'd like to introduce my best friend. You gotta introduce yourself, right?
Me? Okay.
Yeah, you are the best, the most famous person. Susan, my friend.
My big fan club here. Yes. My name is Susan Labhart, and I'm a transition nurse specialist. And I worked at Shriners Hospital in Portland, Oregon for 34 years. And I love to do teen groups to talk about transition. And we did a transition camp for 24 years. And I really learned some firsthand experience about what the issues are about teens growing to adulthood and going into independence. And like Dr. Kim, I love working with the kids and young adults. And I'm just so pleased to be able to be on this panel and share some things and learn some things with you. So thank you. And don't forget to get your pen and paper, because there's lots of good information out there and you might want to write it down later. So thank you.
Perfect. Thank you guys so much for introducing yourselves. Looking forward to having you all here. Would love to get started with our discussion, just some general questions related to our youth audience out there. And would love to talk first about, what do you believe is the greatest challenge that youth with CP face on a daily basis? And then if you could go back to yourself in the youth stage and give yourself any piece of advice, what would it be? So I know for myself, a challenge of CP that I found that I faced as a youth was more of the mental aspect of CP. Yes, we're dealing with physical pain, but there is that mental and emotional aspect as well that tends to creep in. And so I had to learn growing up that I'm not alone, that a lot of other people struggle mentally and emotionally as well. And just because other people aren't crippled on the outside, people can be crippled on the inside, myself included. So I just found a lot of comfort in knowing that I'm not alone in that. And I think a huge piece of advice that I would give myself as a youth would just be not to take myself so seriously. We're growing up, regardless of what age you are, and we're all still trying to figure out what is going on and who we're becoming. And just as we're all young adults on this panel, we still don't have all the answers, and we're still learning and growing every day. So that would be my encouragement. But Emily, I would just love to hear from you about what challenge you believe youth face on a daily basis and what advice you could give yourself. And then Bev, we will hear from you next.
There you go. I forgot to mention that I have spastic cerebral palsy, and I was born with CP. And I think the biggest challenge for me was just struggling to be good enough and struggling with self-confidence and capability is what I kind of went through in high school and kind of throughout college as well. But I learned that, you know, I can do hard things and it's okay if I have to do things different than everybody else. And I think I would just tell myself to not give up and go ahead and pursue whatever, because you can do it. So, yeah.
Love that, Emily. Thank you.
Okay, so I've grown up with a lot of my kids. I've been in this job now for 30 something years, so we've all grown up together. And I think it's this constant need to like be accepted, to find your place and not just to be taken for the physical, that there's more to you. And I think it's very hard in this society. If you look at all the advertising and it's all about the physical and not enough focus on who you are or who you want to be. And I think that's the greatest challenge. And I think the big thing, and I think we've seen from starting this conversation, is a sense of humor is essential. Be able to laugh at yourself, because that I think is the biggest factor. It's already easy for me to say at the age of 60 something, oh, if I look back, I wish I could have done that. But I think bear in mind that you will get through it. You will find your group. I just wish there were more resources, especially for the mental health side. I still feel that the adult world hasn't caught up with the fact that you grow up and you have the right to grow up. So that's my perspective. Thank you.
Thank you. Dr. Kim, would love to hear from you as well. And then Susan, I'll hear from you too.
Right. While I was working with our children as they get older, I think the first one, when they were young, they're cute, you know, they don't realize their difference that much. But as they get older, I think the emotional component is the biggest problem for them, because they start to realize their difference and they cannot catch up. And also it's not simply emotional component, as Meredith says, the physical component comes in. Even though they get therapy, they're already sick and tired with therapy, right? And then they have to start to go to school. But at the same time, the growth spurt during teenager, you grow very fast. So as a physician, I see the difference. They have a lot of pain from the fast growth because their muscle cannot catch up the bone growth. So they feel a lot of pain. Therefore, they also get functional deterioration. They start to fall more. And then they crouches, therefore their gait pattern changes. So a lot of physical challenges are coming too. But what I realized that I think as Beverly, right? Beverly said, I think being funny is the best way we overcome. Funny is not the funny, but being honest. So for example, let's say if I'm gay, but everybody talk about I'm gay, she's gay, right? But you just open yourself, I am. Okay, I'm cerebral palsy, right? I'm different, but being same, no fun, right? There has to be a difference, has to be there. That brings joy and questions and beauty and innovation. So I was telling my teenager children that just be yourself. And then you say you have that one, right? And then I realized that a lot from myself, coming to other country, foreign country, I become disabled. Speech language problems, right? I have trouble with the talking. I can talk, but I cannot deliver what I want to deliver on time and fast enough. And then I stutter, right? And then I get scared. Then I start to say that, I never want to speak English better than genuine American, right? I have to say that. Then I said, I have a cute accent. They don't have that accent. That's the way I start to talk. And then people start to laugh, right? And then I buy time and I can talk now, right? So I think being ourselves are the best. That's the way I usually talk with my patients.
Wonderful, thank you.
And
I think part of the problem that youth face is how other people see them. They don't have, I'm seeing even, some friends or people in the community, they don't expect a lot. Well, they're in a wheelchair, so they're probably, going to have to live off of SSI. I always like to ask kids, if you didn't have the disability and money was no object, what do you want to do? And if they tell me what they want to do, I said, that's where we're going to start. And sometimes if you want to be an actor, that can't be your first job that pays a lot of money. It takes a while. So let's get you something that you can do, and then do that as a hobby, do community work or something. But people don't ask those questions, I think, and health professionals don't start early enough asking those questions. And then all of a sudden, this young adult is an adult, and now they're asking these questions. I want to get out of the home. I want to make some extra money. SSI isn't enough, and it's harder. So I just say, let's not lower our expectations. And nobody on this panel, I'm not talking to anybody on this panel like this. I'm just talking about the community. Let's raise our expectations and expect people with child onset disabilities to do what we expect everybody else to do. So thank you.
I love those perspectives. Thank you, guys. And just on a more positive note, I would love to know, Emily, tell us about a victory that you've had with your CP. Oh, unmute yourself for me. Yeah, perfect.
There you go. In high school, I learned that it's really important to advocate for yourself and to learn your self-worth. Going into my junior year of high school, I was having a lot of trouble opening the doors, and because I used a walker and a wheelchair, and so I was having a lot of difficulty. And so I decided that to do something about it, and I went to staff, and they suggested having an adult with me to open the doors whenever I needed to go out. And like, we're in high school, like, who wants to walk with an adult with them all the time? And so I wanted to start a campaign called Keep Calm Install Handicap Doors. And I actually raised money to put in an automatic handicap door in my high school. Well, little did I know that it was gonna go big, and we were able to put in 15 automatic handicap doors in my school district. So I say that was a victory for me. So.
That's amazing, Emily. As soon as I heard that story, I just knew you'd be perfect on this panel. And I know so many people listening will be so inspired by you. So thank you so much. But would just love to jump into our first challenge that you face of bullying, and then the aspect of friendships as well. So Lynn will be moderating that section. And Lynn, I would love to answer your first question.
Okay, great, Meredith. So, well, it's almost like a rhetorical question, right? Was bullying a problem for you growing up? I think almost everyone has experienced bullying on some level, even if they're a bully, right? But I think it's something that young people with CP struggle with a lot, perhaps. And so, how much of a problem was it for you? And maybe how old were you when your peers were the most unkind?
Wow, like you said, bullying is a universal challenge, but especially as someone with CP, I definitely did experience that. First time I remember experiencing it was more in my elementary years, especially when I was recovering from surgery and I used a walker at school. I remember I would go down the hallway and some kids would tease me and call me grandma with my walker. And then I had some kids that would stick their feet out in the aisle and try to trip me. And then I had some kids that would imitate my gait down the hallway. And that was really, really tough to be different and to have those comments and actions against me. But something that I really learned is that people who are bullying you are often insecure about something themselves. And so I did learn as I got older to try not to take it as personally, and just to realize that everyone is going through something, and that doesn't excuse bullying by any means, but it does help lighten the impact of the bullying. And words have a lot of power, so just encourage the youth out there to speak life to your peers and to friends, because words are really powerful.
Yes, that is very true. Very true. So Beverly, I have you on here for this topic. Is there something that you'd want to say about maybe an age at which you see patients complaining the most about bullying or social challenges?
I would say middle school. I would say middle school is ruthless. And it seemed to be more so the girls than the boys. It was slightly, we did a little study on it just to have an idea. And all the kids that we talked to were after middle school, but all their experiences happened in middle school. And a lot of it was either being called names, or exclusion was the big one. And initially we thought the more disabled you are, obviously, the worse it's going to be. And it wasn't. It was those that were milder were the ones that were really picked on. Because if you're in a wheelchair, well, then you can't play basketball or something. But they were the kids that could have done something and could have participated. It was all about winning as opposed to being on a team. But what was really great was that all the kids that we talked to felt themselves to be smarter than the bully, and all had a wonderful sense of humor. And so they might not have been stronger, but they were incredibly resilient. But again, middle school, it kept coming back to middle school. What is going on there? That there's this division. In high school, they kind of all shuffled out, though, which was good. They found their groups depending on what they were. But middle school, brutal.
And that would be consistent with people that I have talked to. My daughter actually had a DSP, a direct service provider, at one point, who was a young woman in her 20s with mild CP. And when I talked with her about this issue, she said kids were friendly in elementary school, they were mean in middle school, and then they chilled out again in high school. So, her experience is consistent with what Beverly said. And it kind of makes me thankful, because for my daughter, she was fully included in her elementary school. And then we made a choice to put her in a more supportive school setting for middle school, which I think removed her probably from a lot of potential situations for bullying. And it wasn't until just now when Beverly was talking that I was thinking, wow, that was probably actually helpful for my daughter to have been in that different situation in middle school. And then too, she is more severely affected by her CP. And my impression, of course, I'm not her, so I can't say for sure what she experienced. But my impression when I was, helping out in the classroom or being in the school in elementary school, the students really seemed to gravitate toward her. She was like a magnet because she had this cool equipment, right? She had a communication device and she had a power wheelchair. And they wanted to know more about it and to see how she used it and to help her with things. So, I think that too is consistent, because the more typical you appear to be, then when your differences do become apparent, they become subject to scrutiny and teasing and things like that. And when your differences are more obvious, I think there's probably some peer pressure there too. Like, how awful must you be if you're going to make fun of the kid in the wheelchair? So, and then too, she had an adult attendant with her a lot. And like Emily said, you know, do you really want to go through your day with an adult right next to you? She didn't have too much of a choice, but it was also a buffer. It can be a barrier to making friendships because the kids don't want to be around the kid who has the adult right next to them. But it was also a buffer for her against meanness. So there's two sides of that coin, I think. Okay, so also on this topic then, did you have a champion at some point who helped you to get through a bullying experience or a time in your life that was hardest?
Yes, I mean, I struggled in my middle school years as well, with identity and physical appearance also. Like we were talking about before, the middle school years are ruthless, but I did have someone, thankfully, and it was actually my voice teacher growing up. He was born with one leg. And so we were really able to connect with one another, and I was really able to go to him when things would get really hard or bullying would get really hard. And he would just focus on my abilities and what I could do, and really helped me lean into the potential that I did have, just kind of like Susan was talking about earlier. If there's something you want to do, go for it, do it. And he instilled that into me. And so I'm very, very thankful for him and his ability to help me.
Anyone else want to talk about champions or who might have been helpful?
I think for me, I didn't really go through the bullying phase. I was fortunate enough to have friends who were supportive, and my friends and teachers were very supportive of me. And when I was sad, they were able to cheer me up and help me get through the day and stuff. So yeah, like the teachers and students were a big part of my success.
That's great to know. So for clinicians, do your parents ever share with you that they are dealing with bullying?
Yes, they do. I mean, this is, excuse me, how the whole project started was that the lady in question, she's also dysarthric and she has dystonia. And when she gets upset, the hands are flying. She can't make herself clear. And she accidentally knocked off someone's glasses. And it's a no tolerance policy. And it wasn't her fault. She was provoked. And they knew this would, and they took advantage of it. But she was the one that was suspended. And so she made us aware of this. And this is how we started the whole project. And then it just rolled from there, that they were so willing to tell us their experiences and how they dealt with it. And we made sure parents were present because these were all minors. And even the parents were amazed because some of this they knew, some of this they didn't know the extent. What the kids did to overcome it was very creative for some of them, but they are very willing to share if you're willing to listen and you're willing to ask, but you first have to ask.
That could be my problem because I did not really pay attention to bullying part. So I never asked that questions. It's actually, I confessed that I never involved that kind of a conversation, but more like a medically related to problems. So I think now I'm learning through this panel discussion that even though we are medical doctor, I think we should pay attention to every corner of difficulties. Even though I tried every corner except I think bullying, I just sitting here and go, wow, I never asked that questions.
Yeah. Where I worked, we had like a no tolerance for bullying, and we had a day where we celebrated inclusion and anti-bullying things. And I just wanted to say that I think one of the best resources out there, because people are cyber bullied too, especially with all this computer stuff, is PACER, PACER, and they have a PACER Teens Against Bullying.org website, and they have videos and they kind of role play and they tell you what to do if you're bullying, you feel alone, to talk to your teacher, get some friends. Pacer also has a national bullying prevention center. They have videos, education, and help. And we have bookmarks in our lobby with this information because it's embarrassing to be bullied. And they have these great bookmarks with all kinds of people on them. And it said, are you bullied? Here's a number, or, here's a website. So pacer.org/bullying. And also there's stopbullying.gov. So those are some ways that people that don't feel comfortable talking about it can help themselves and learn what to do. Thank you.
That's awesome. Any last thoughts about the bullying topic before we hand it back over to Meredith to talk about friendships?
Okay, well, thank you guys. Really good input there. Friendships are definitely really important, especially finding that support when we're going through those hard elementary school, middle school years. But a unique element that CP brings is telling your friends about your diagnosis. And that can be really, really scary. And I remember just trying to navigate, do I speak up? Do I wait for someone to ask me? So I remember a lot of times I would wait, and sometimes I would just be very open and transparent and say, hey, have you noticed something different about me? This is something unique about who I am, and it doesn't define me, but it is a piece of me that I want you to know about. But would just love to hear from your perspective, Emily, how would you tell your friends about your diagnosis?
Yeah, well, I didn't have too many friends in high school, but the friends that I that were supportive, I just told them, I was upfront with them, and I just told them that I walked differently, and if they had a question or whatever, I would answer it. And so I was just very transparent, like you said. So
That's awesome. And being transparent is really important. And often I found that their response would determine, if they were a true friend or not. You always look for friends who are accepting and supportive. And so that is a bit of an advantage that my diagnosis brings me, is really being able to see who's authentic and accepting of who I am. And so that is something that I'm thankful for. But it is really important to have that supportive community. A lot of youth are feeling alone and need those friends, and a lot goes on with social media, and find that even though it's called social media, it's a little bit less social. And so it's important to really have more friends and not just followers, and really put yourself in front of people and find that supportive community. So Susan, I would just love to hear from you. What advice would you give for finding those true friends and supportive community?
Thank you, Meredith. I really like this question because friendship is central to everything else we're talking about. So I did take a couple notes on that so I could talk quick and not leave out any things. But regarding friendships, finding true friends and a supportive community is important for your quality of life and to be as independent as possible as an adult. You can start by being part of your community, like going places, attending events, volunteer in an animal shelter. There's also some great books on friendship that you can get at Amazon.com. Research says that 4 or 5 friends are good, but 1 is essential. So I encourage everybody just to get out there and look for a friend. And some people, even if you don't have a child onset disability, have trouble finding friends. So a friend told me that they were told to say or do nice things for friends. Maybe try saying nice things to 3 people a day. Finding a role model, someone that you really admire, to see how they would be a friend. Make a list of where you want to go to meet friends or good places to go on a date, and be creative. If you're lonely, ask somebody over. They may say yes. The number one reason, and I was surprised about this, for decreased social experiences are overprotective parents and negative attitudes of others. So You out there have the power to reverse these thoughts. Have a talk with your parents. Work on self-determination and controlling your own life. And this includes developing independence skills like going to the bathroom outside the home. Consider an incontinence pad if you need help going to the bathroom, or hire a personal care attendant. Try to start doing things outside the house, like participating in recreation, sports, camps, clubs, and look into organizations related to your diagnosis and go to their groups or conferences. Eventually, a true friend may knock on your door, but you could be 80 years old. So get out there now while you're still young. It's okay to be open. Social mistakes are more acceptable in youth than in adults. There is a National Center on Health, Physical Activity, and Disability. It's called NCHPAD. That's NCHP as in Paul, AD as in David.org, and then /directories/organizations. And that lists recreation opportunities in your city or state. You can also think about going to work in community college to meet peers. Some people just go to college to meet somebody their own age. You're surrounded by thousands of people your age, because good friendships lead to good work skills, and good work skills lead to good relationships later on. So if you had a difficult past, try focusing on moving forward. A tree is known by its fruits, not its roots. So it's okay to get a counselor if you need some help. You can also learn about friends and relationships from adults. A lot of people with affected by cerebral palsy don't all have a peer to talk to. You guys were lucky, but some people feel really alone. And so they have to learn from adults. And so if you don't feel comfortable disclosing to a friend, talk to a safe adult about what you need. If you don't get your answer, keep trying. Write down the needs if they're difficult to verbalize. Role play social situations to feel more comfortable. Tell your friend about your disability in a way, like Meredith says, that and also Emily, that emphasize your strengths, and tell them only what they need to know. You don't have to get into the bathroom stuff on the first time you meet them. And sometimes it takes more patience, acceptance of differences, and work to be the boyfriend or girlfriend of a person with disability. So some people aren't ready for that. So wait until you find someone who is ready. Again, go to places where you're likely to meet people who enjoy the same things you do. And if you're approaching a group, blend in. Observe and then blend in. Because if I was approaching a group of people on a motorcycle, I might think, I don't know about motorcycles. That might not be the group for me. But if people are talking about skiing and I hear that and I thought, well, I'd like to talk about that, that's probably the group that I might feel more comfortable blending in. There's some people use websites as they get older, like meetup.com, to go somewhere with a group of people who have like interests. If you can, invite a friend along. If for your older people out there, if you use a dating website like dateable.org or disability-dating.com, Dawn Disabled Dating or disableddatingclub.com, realize there's always a risk because you're not sure who's on the other end. So if you decide to go with that, always let your parents or a friend know where you're going, and plan to meet with your friend in a public place because there's safety in numbers. Not everything can be done online though, and realize that sometimes computers can even lead to social isolation. So you know that a person with a disability has the same needs as everyone else. I had a social worker friend who was also gay and had cerebral palsy. He wanted someone to accept him for who he was, so he finally joined the gay men's chorus. My friend did walk, but had a very awkward gait that he was really uncomfortable about. So he knew he found the right person when his friend said, "I love the way you walk." A first date can be stressful for anyone. I mean, God, my kneecaps were shaking the first time when I went out. So you want to suggest to use all your senses, especially your sense of humor, like Dr. Kim said. Ask your friends questions about things that they like to talk about. If you like, I used to ask, if you could go anywhere in the world, where would it be? And that takes the attention off yourself. And while they're thinking an answer, you can think of your next question. Do things to increase your self-esteem. It's a huge factor, especially with cerebral palsy. Confidence is attractive. Work on a plan what to do in certain circumstances, like who to call if you're out and you want to go home. Consider an alarm on your wheelchair. Office Depot has them for $7. So if you make a mistake or somebody's not who they think they are, push that alarm. People get scared when there's loud noises, and that'll give you a chance to get away. If you do have a power chair, use it to attract attention and meet people. For example, if you think someone's nice looking and they offer to hold a door or get you something, let them. Then use your personality to keep them around. If you're not attracted to them, just say, no, thank you. Balance out your life. You can't play all the time, work all the time, eat all the time, or sleep all the time, or be with your friend all the time. Put a little of these things in every day and in every week. So thank you, but I didn't want to forget anything. So thank you for bearing with me.
Oh, that was wonderful. Thank you so much. A lot of really helpful resources and stories. So thank you so much. Bev, do you have anything that you'd like to add to that?
Something is incredible. That, but thank you so much, Susan. So much of it is true. Like you said, being true to yourself and speak up and speak out. And this is something we do try and work on the kids. You know, what are you doing? What do you think? And it's hard, yes, very hard for parents to let go, but you have to give them their wings to fly. And it's so hard to find friends and not trust in the social media because there's so much pressure. But that factor of having that one friend makes all the difference in socialization and getting you out and giving you confidence to say, I can do it, I'm not alone. Like Susan said, so many truths. I mean, just overwhelmed. Thank you, Susan, for that information. And I will definitely take some of it back to clinic with me. Thank you.
I love stories.
Yeah, I like to add one thing. I'm just like become myself with the cerebral palsy. I hear the speak up, speak out, you know, get involved, which we can say easily, but when it comes to the patient, it's not really easy. You know, many our patients or people with the cerebral palsy cannot speak or cannot speak out even. So they try to talk, but people don't wait. I think the friendship is very important, but we have to create the environment for them to speak out or reach out to them. So I think we have to share how we can make people to wait for us, right? I want to talk, but people don't wait. When I was resident, one of the nurses was asking me because she knows I am crazy about cerebral palsy. Dr. Kim, when you become real doctor, because I was a resident, I was not a real doctor, I should say. When you become real doctor, please do the research on cerebral palsy and depression. I said, why is that? She said, all my patients who are in this institution, adult with cerebral palsy at the time, more than half, about 75% patient on SSRI, the antidepressant. So she, as a nurse who observed them every day, she say, half of them didn't have a depression, but when they go to the doctor's office, they speak very slowly. And then they try to say something and the doctor says, oh, you are very depressed. So they put the medication. So when I listened to the panelists today, right, we all want to do this, speak out, stand up, be attractive. People has to wait for me to say something, and then I can get friends out of these many people. So I think we as a group have to think about how we're gonna make other people to understand us and wait for us.
Of course, yeah, it's really great insight. Thank you so much, Dr. Kim. Are there certain qualities that you tell your patients to look for to find those true friends and supportive community, or how do you find those true friends and supportive community? Beverly, have you ever addressed that with your patients?
Yes, we have. We try and get them, like, you don't necessarily have to look for someone like you. That best friend could be around the corner and you just need to be open. So there are various groups we try and get them involved in to try and find their interests. So when we see them in clinic, I don't just ask, do your braces fit? It's like, what have you been up to? Where have you been? What's your interest? To try and sort of say, okay, well, look, this is a resource we have. What do you think about that? Go down to the Life Center. Let's see what we can do. Just to give them opportunities. I don't really want everyone, you know, Dr. Google isn't necessarily the best resource, but that's what we're up against a lot of the time. So we try and bring it into the visit to make it not just focus on your CP, but you as a whole, and what are you interested in? I spent this morning talking about Iceland. That was the whole visit. They'd been to Iceland for a month, and we talked about their interests with that. And I got some tips of where to go. It was actually very beneficial. So it's things like that. What groups do we have that we can involve you in? Who can we connect you up with? I mean, yes, you're right. I can only give you the resources. I can't make you do it. And Dr. Kim's absolutely right. For the adults that we transition, and I know Susan may disagree, but it's very hard to be transitioned to adult land. And it's like, okay, off you go. Because there's somehow a disconnect between the adult and the peds. You know, we're very hands-on. There, the comments we've had from the young adults we've transitioned, they're not focused on the whole. So I still think part of the learning curve to help the adult side catch up with the ped side. Here I'm giving you all this resources, and then you get to the adult side and you respect to fend for yourself. So like Dr. Kim said, I think we still have a ways to go.
Of course, yeah. I think it's really important when you're looking for those true friends, just to also look for the people in the room that need a friend. I know a lot of times I was so focused on when I walked into a room, you know, who's going to talk to me, who's going to approach me and be my friend, which is okay. But definitely, as Dr. Kim was talking about, and but really even transitioning into adulthood, it can be really difficult. And so I think it's important to realize that other people need friends too. And so I would just encourage the youth out there to look for people who are positive, who will speak life into you and accept you just as you are. And like Susan, you said, confidence is attractive. And so that's definitely a point of growth and looking for friends. But does anyone have anything else to add as far as friendships in a supportive community?
Yeah, I wanted to say I do agree with Bev, and that brings me to the point, we don't start early enough with anything. It should really start at diagnosis, to talk about friends and to raise, and I'm sure Lynn's not gonna have this problem, but you raise your child like they are going to be friends with somebody, that somebody's going to want to be with them as an adult. So I think that these conversations should actually start at diagnosis. We should not wait till they're out of the pediatric system into adult health care and then see them depressed. So I do agree. I thought of some qualities that I wanted in a friend, and I wanted someone who was nice and fun to be around and like to do the things that I did. I think it's important, especially if you have a child onset condition, to find a safe person, someone you can trust. Someone who asks you to do something you're uncomfortable with is really not your friend. They should treat you like a friend and respect your boundaries. Also, you can't just hug or be hugged or touched without your permission, especially as you grow up. Sometimes people with child onset conditions are treated like a kid, like you can just go up to somebody 21 and hug. I mean, I wouldn't want a stranger to do that to me without my permission. And you should find someone that makes you feel good about yourself. And friendship includes loyalty and commitment. Can I just say a couple words about how you can be a true friend to others? Is that all right?
Absolutely, yeah.
Okay. Be prepared to take the active role to help your friend feel comfortable with you. Have a plan, manage your disability, take care of yourself, and brush your teeth before getting together with a friend. Be clean and odor free. If you looked in the mirror, would you be attracted? Smile, feel good about yourself first, and list the things you're good at. Offer to help friends when they need it. Keep your word. Accept different views and ways of expression. Everyone has needs, and people express those needs differently. Do things together, cooperate, comfort and encourage your friend, respect a friend's privacy, and give your friend space. Understand if your boyfriend or girlfriend wants to be alone or hang out with other people. Time apart gives you breathing space. And I got this from Chuck, my friend with cerebral palsy. He said when he first found a friend, he was all over him, calling him every day. And what are you doing next? What are you doing this weekend? He said he burnt his friend out. So he did recommend time apart gives you breathing space and a chance to appreciate each other. Talk to and listen to your friend, communicate honestly, and be a friend. That's all I have.
That's great. Thank you so much. Definitely some great qualities to look for. I know we talked about starting this discussion early in clinic and really being open and honest about friendships and what's going on in our patients' lives or in our friends' lives. And Emily, you addressed putting doors in the school, which is amazing, but any other insight on what environment we can create for people with CP to be more inclusive and supportive?
I'm sorry. Emily, you do first, and then I'll.
I was just gonna say, when we did start the campaign, a lot of people, even staff, didn't know it was that automatic handicap doors was a need for us. And so just being aware and being advocacy and don't be afraid to speak up, because one voice can truly make a difference.
So what I was going to say is that whenever we give a lecture to the people, that cerebral palsy is the most common childhood onset disability, right? So in the country, in the world, cerebral palsy is the most common disability, but we don't see it in the community at all, right? Nobody with cerebral palsy on TV. Right, but we had a brief moment that there's some, I think, a show who hosted like a cerebral palsy person become the main actor. One point, that was it. So it's very, very few presence we have, and then we don't teach disability at school at all. We segregate them. We send them our patients to special school, special class, and then when we only go to the community to deal with the disease itself, right? Doctors, only doctor's office, but the rest of them, you go to the special place with the special friends. So I think for us to create the environment where we can be inclusive is that we have to educate each other, bring the awareness. I think if we are on cerebral palsy on the TV every day, I think at the end, the people will be sick and tired. They don't see you as a CP at all, right? But if we put the CP in special corner, special day, today's a cerebral palsy day. Okay, you're cerebral palsy, so what? Then they forget. So I think we all, as an organization, as a group, we have to really pay attention to get into education and bring the awareness. I think that's going to really be the game changer.
Absolutely. Thank you so much. That's an awesome perspective. Bev, do you have any? Oh, sorry, go ahead.
I'm sorry. And it just reminded me, we need to put the person before the diagnosis, because I've had people introduce themselves like, I'm Tim, I'm a CP. And I thought, no, you're Tim, you're a person, and I've had doctors say to me, will you see the CP in room 4? And it's like, the young man with cerebral palsy. I mean, and I think with ourselves, I think that people that have hearing impairments, they want to be called deaf. I am deaf. I don't, I'm not hearing impaired, but a lot of people, I wouldn't want to be referred to as a cancer patient. I wouldn't want to be referred to as a CP. So I think we all can work on putting the person first. And the people I've talked to appreciate when the diagnosis is something secondary. Thank you.
Awesome. Would definitely agree with you there. Does anyone have anything else to add? Yes. Oh, unmute yourself for me, Bev.
That you have to see the person first. I even catch people in the profession saying, oh, the CP kid, and then we have to catch them and say, no, this is first a child, and this is what they have. So it's not just teaching the general public. I think it's also educating those within the profession that how to talk, how to listen, how to understand and work with children or young adults or anyone with a disability, that they're more than a disability, because we're still teaching them. And I don't know how Susan finds it with transition, but we're still trying to teach the adult side for the medical side that no, this is not a disease of childhood. This is a person who has cerebral palsy, and this is what it means. So there's a lot more education, not just the general public. I also think within our field as well, we're still working on it.
Of course, thank you. There's definitely more work and education to be done, but this is a great step to take and raise awareness, even just with this panel. And would love to just move on to talk about body image, as that's another struggle with youth. And so I know everyone struggles with body image, but CP does bring a unique element to that. And so would just love to hear from you first, Emily, when you struggled with body image and when you might have realized that your body looked a little different than everyone else's.
Yeah, in elementary school, nobody really cared. I had a lot of friends, but then going into middle and high school, it became harder. And I kind of realized I was different from everybody else when I had to use more assisted devices like a wheelchair, a different table. And so I had to do things differently. And that was a real struggle for me. But it was practice, and I just learned that I can be myself and can make friends that way. So, yeah.
Thank you. I know that's a vulnerable piece to share, so thank you so much for sharing. Dr. Kim, I would just love to hear from your clinical perspective and your thoughts on the struggle with body image, either personally in your youth or what your patients have talked with you about regarding body image.
I was thinking about myself when I start to feel about myself differently or like shame. I think I was very cute when I was young. I never ever thought I can have that kind of concept, the perception about myself. But as I get older, when you go to high school, you become a little chubby, you are not growing anymore. So I start to feel, I wish I can be more like a thin and tall. But the funny experience what I had is in Middle East. It's good. I think it goes very well with this story, because when I go to Middle East, a lot of South Asian is working as a homemaid or a housemaid people, right? And then the people, all Western who lives in Middle East, they're very tall, the light color people. And then, so when Asian goes to Middle East, they receive us as a servant, their servant. So one time I had a very interesting, because I'm Dr. Kim, I'm very famous Dr. Kim. But when I go outside, who knows who I am, right? So it was a swimming pool, I was walking. And then I realized that the person I invited to my hotel is a very tall, white female physical therapist. So I called her back. Alicia, come here, come here. She said, why? Okay, hold my bag and then you walk behind me. I don't want to look like your servant. Right? So this is body image. What I start to realize that what my patient feels about themselves, right? And then sometimes, because I'm small, different color, and then when I go to operating room, they think I'm a nurse, right? They don't consider me as a doctor. So it's different perception. It's not body, but the look is different, right? So as a physician for my patient today, when they complain, oh, Dr. Kim, I cannot walk fast, the little children start to complain about that, about 5 years old when they go to school. I cannot walk fast. So you know what? I usually talk to parents that don't insist that they have to walk. They can walk in house. But when they go to kindergarten or go to friend's house, give them a wheelchair, power wheelchair, not the regular wheelchair, so they can move fast. So actually, one of my little boys said, Dr. Kim, thank you. Then he went to school with a power wheelchair before he was walking with a walker. And he was moving faster than anybody. So he became hero. Everybody want to follow him. So he was the most popular guy in the room. So I was learning that the body image is a perception, or affective, or it can be cognitive, right? Then we have to change these things by applying this different tool to tweak the body image. That's what I want to say.
Yeah, absolutely. Discussing that with your patients can really change the way society views body image. And Emily, do you have anything on how I know we can start to change our viewpoints on body image? Dr. Kim mentioned that education and awareness and having those discussions is really important.
Yeah, I think like you said, being transparent, and because CP is kind of visible, and so you know, I knew from the start that I walked different from others. So just being confident in yourself, I think, is really important.
Absolutely. And then how do we come to a place of celebrating and accepting our bodies? Because that's really important too.
Mm.
Yeah, for me, it was just like I said, practice. I had supportive friends, and I knew that I could do things, and I had to tell myself that every day. You are worthy. You are important. And that did build up my confidence to do things. So yeah.
It's awesome. For sure,
Yeah.
our bodies are amazing tools, and whether we have a diagnosis of CP or not, the things that our bodies can do are amazing. So it's important to keep that perspective. Anything else that anyone has to say before we move on to
Right.
career?
I was thinking about the difference, right? And then the body image, and including how we celebrate the difference. You think about the people who they love their pets, right? Do you think they're very cute? Do you think they walk fast? But they're all cute. They love them. So so whenever I think about the pets, why they all get loved, but why we don't get loved by people all the time, right? So it's very different concept why we have what we have, because it's by education, I think. And then the animals, they don't talk back to us or those things. So what I was thinking, the difference, because if the pet looks all same, people will not love them, right? They're all different in some way. The humans are same because we are all different. And if you are same, what brings joy and beauty? So I think I really like what Susan says, that confidence is bring the attraction, but confidence to me, I actually wrote same things, but I said being confident is bring the beauty. You have to be confident, but also you have to be different. But you have to educate yourself that I'm different, therefore I'm more beautiful, right? We have to have this kind of mindset. It's going to change. But if we all same look, same people, then the world is going to get so bored. So
Right.
we are contributing all the important difference to the world. So we are the
Yes.
most important elements than anybody.
Of course, you're absolutely right. Thank you guys so much. It's definitely an important topic to discuss and work through. But I'll let Lynn take over our career and passion section.
Okay, so we want to wind down our panel today by talking about the topic of career paths and passions. So first, to talk to our youth on the panel, what are you passionate about? What gets you out of bed today and each day, and what were your passions when you were younger?
Well, I would say, for me, I'm a nurse, and so I'm very passionate about my patients and caring for them. That's something that gets me out of bed each day. My faith is very important to me, and that hope and joy that I experience gets me out of bed each day as well. But I definitely was passionate in my youth about theater, and would definitely encourage youth that are listening to just find something that you're passionate about and that you enjoy doing. And I was also involved in some leadership organizations in high school that involved travel and attending leadership conferences and just growing in those leadership skills. So just encourage the youth to find those areas. You don't have to be like everyone else, like we've been talking about. If you're unable to participate in the sport, maybe try theater, or try art or music or something that brings you joy. So that would definitely be my input.
How about you, Emily?
Yeah, for me, I think from the campaign itself, I learned that it was really important to speak up for yourself. And so I became passionate about advocating for others and bringing awareness. In high school, I found that I was able to participate in the PEP squad. And then my senior year, I was an athletic trainer. And so, because going into my freshman year, I didn't know if I could get a Letterman jacket. And I was like, oh no, I can't do anything. But building my confidence and getting into those groups, I was able to get my Letterman jacket. So yeah, speaking up and being confident is really what I'm passionate about.
And I would say too, don't hesitate to, like, there may be something that you're really passionate about or interested in, but you just think, oh, there's no way for me to participate in that. But voice your dreams and your hopes and everything to the people around you, because maybe if it hadn't occurred to you to become that athletic trainer, maybe a teacher, if you had said how interested you were in basketball or volleyball or whatever the sport was, a teacher might have suggested to you, well, why don't we ask and see if there's any opportunities to become an athletic trainer? So never hesitate to share what your hopes and dreams are and your passions, because you might feel like you've reached a hurdle that can't be overcome, but then someone else can help you find a way around that hurdle, and find a way to help you participate in that passion. So as patients or youth navigating CP, what advice would you give in pursuing a career then and transitioning into the job field?
Well, I'm very glad that you asked, because my advice as you pursue a career is to volunteer. You can get to know the company or job before you're committed to it. One guy volunteered as a 911. He wanted to be a 911 operator, but it was a lot of work to it. So he volunteered, and he says, God, I don't want somebody's life depending on what comes out of my mouth. But he liked the medical setting, so he volunteered at a hospital, and he knew where all the x-ray and everything was, and he was very social. And so he volunteering kept him from wasting some time in his mind. Some volunteer opportunities are also available before you're 16 years old. So it's a way to get experience and think about what you might like to do and what you can do before graduating from high school. So there are some people to help you. You can also contact your county or city vocational rehabilitation center when you're 16 years old, and they can also help you evaluate what you can do, what jobs are out there, and help you train for those jobs or get your GED. Pursue your dreams. If you need to work, or if you are on SSI, but that's not enough money, get a job and pursue your dream as a hobby at first, like becoming a photographer, writer, or an actor. It's hard to maybe start with those jobs, so some people just give up, but just realize that you can maybe pursue it, but maybe you need to get some money first. I suggested making a goal map. Think of putting yourself on one side of a stream and a circle where you are now, and then where you want to be on the other side. So like this is you now, and you want to get a job which is on the other side of the stream, and then make stepping stones of what it would take for you to get to the other side. For example, if you just graduated from high school, and the goal is a job, stepping stones, it might be calling vocational rehabilitation. It's free. Volunteering, maybe attending community college for training. They have college disability student services and at the universities. So there are options. If you can't find a job, get an education, enroll in a local community college. There are also work-study programs at many colleges and universities. You can participate in recreation sports and other activities outside the house. As I said, good social skills lead to good friendships, and good friendships lead to good work skills, and good work skills lead to good relationships. So there's a lot of benefits to working. Keep a little notebook of community contacts and questions you may have. Consider, and I think Dr. Kim brought this up, augmentative communication devices if speech is an issue, because people are impatient, and you could be the smartest person in the world, but if you can't get out or speak slow, people are busy and they don't always want to listen. But if you can get, see what get a referral to a speech therapist, and then find out what's there for you and how you can get your words out in a place that the community can understand. Parents and through high school, they're used to speaking with you, they can get it. But sometimes in the community, people don't know what you have to say. Also speak to your occupational therapist or physical therapist about any equipment you may need to be successful in the workplace. Look into adaptive driving or public transportation to try to get to work or school by yourself. Strive for a sense of independence, which means you can direct your own care. If you need a personal care attendant, if you need help at home, work, or college, that might be another option. PACER, and I mentioned this before, PACER recommends building skills that employers want, developing good work habits, highlight talents, and convey a positive attitude during the interview. Expose yourself to a range of work-based experiences, site visits, community service, job shadowing, and paid and unpaid internships. I had a patient that wanted to work in the medical field, a different patient, and he called the hospital human resources department and asked what student internships were available. And there was one in a research department, and it turned out that he loved it, and he's taking that career path. Some are paid or some are unpaid, but they get to know you, they know you're reliable, and it could lead to something else. And tell your future employer what you can bring to the company, like, I am reliable, I am kind, I am trustworthy. Not that, well, I need a job. Tell them what talents you have. Whether or not you think you can, you're probably right. So plan on having a good career. That's all I got.
It's my turn.
Yes, it is.
Yeah. I really have nothing to say because most of my patients with the cerebral palsy really had the difficulty with getting the job. And I keep just thinking who were able to get job. Handful of patients, even though they went to school, they were educated. So in my mind, if they can study well, I want them to be professional job, something like nursing, physician, something with some technique, right? And then computer science, those things. So then I have a funny story because one of my very good looking guy, diplegic cerebral palsy, he has muscles. I love him so much. He's my boyfriend, right? So one day he came back. So I was talking to him, like, what kind of job you gonna apply? Everybody is gonna like draw on him. And he said, Dr. Kim, can you believe this nonsense? So what is that? And he said, I'm not going to look for the job anymore. And he's diplegic, so he has a very attractive gait pattern, right? So he was walking to the office, and then the lady who is going to interview him, she said, oh, I did not know you walk that way. We don't have a job available. I said, you can sue that lady, right? But even though he's smart, good looking, it doesn't matter. I think most of our people with the cerebral palsy suffer this part. But I think Susan's comment is very, very important. That you have to be confident. You have to have a good relationship. Sometimes you have to silly, funny, but you have to get their attraction to get your goal. But I would say, before you get into college or high school, you have to really think what field are you going to go, and then strategically you have to approach, is this really possibly I can get job if I study this one, right? We all want to work. Not everybody working for what they want to work, right? But everybody want to get the job anyway. So I think we have to be very careful. What's my function? What I can do, what I can offer. I think then we can be very attractive. We can be communicated with our people. But I think yourself has to assess who you are, what you can do first. That's what I usually tell my patients.
Yeah, definitely assessing who you are is really important. I've had to ask for accommodations in college and at my job. But I just want to encourage the youth out there that try and see it is possible. I was the first person at my university to go through nursing school with a physical disability, and it was not easy by any means, and I did struggle each day, but did talk with the dean of the nursing school and just really found a lot of support with her. So I would just encourage, find something that you love, do acknowledge your limitations and ask if you can get accommodations, but don't be afraid to ask. And very thankful by the grace of God to be where I am, but absolutely there's hope to find a job that you love.
Right, Meredith, thanks for saying that. That was my actually first line to say that don't give up, do what you like to do. That's what we do all. But I think we really have to be, just like what you say, you go to dean, you have to do your best to convince people, convince yourself. And I want us to get the job. And even hospital, even ourselves not providing job to our people with cerebral palsy, even rehabilitation department. I get so angry, you know, why can't they get job in our department? Even cerebral palsy center, they don't hire people with cerebral palsy many times. So anyway, but do yours. And then many of my patients, actually, they're movie star, they're writer, you know. I don't talk about those people, but someone who is always hesitant to go forward, then you have to strategically approach your future.
Great. We're doing a great job talking about, you know, how to go about finding a career path that fits your passions and your abilities. Interesting question to think about next is, in what ways has CP actually helped you or created a positive impact in your career path?
Well, definitely, I asked for so many years every time I would go to the doctor for a checkup or physical therapy or have a Botox injection. I would always ask why. And that was something that was really hard as an adolescent and as a young child. And it took me about 18 years to find that answer through my calling of nursing. So I am very thankful for my diagnosis. It has helped me be able to relate to my patients on a deeper level, whether they have CP or not, just being in the hospital environment. And then it has given me a more empathetic side and a more compassionate side. So I'm very thankful for my CP in a way of leading me to pursue nursing. Again, it wasn't something that I had thought of my whole life, but then just kind of realized as I got older that I could really use my diagnosis to help other people.
Thanks, Meredith. All right, well, then to kind of wrap things up, any other resources that you would like to share to parents, youth, or patients that could help them in their search for the right career path for them?
Yes, I wanted just to add about finding a career or passion and dovetail what other people said, and then I'll get into some resources. Think about what you like to do. Do you like to work indoors or outdoors with people or alone? Volunteer, talk with friends about how they found a job. Try to put yourself first ahead of the diagnosis. For example, you can say, I'm Ann Jones. I have communication and computer skills that would be an asset to your company. I'm honest, trustworthy, and work well with others. You may have noticed my power chair. This helps me to get around quickly, but does not interfere with the work I can do for you. So think about how you can make money doing what you're passionate about. And if not, get a job you can do now and make your passion a hobby for the time being. A guidance counselor or college disability access specialist can help you to reach your goals. So some resources that I listed, and that's why I hope that the audience has a pen and paper, but even if they only try a couple, it's something. There is, again, volunteer.gov. You can Google AmeriCorps. There's an IEP or guidance counselor in high school. They can sometimes tell you who to call in your area. The Disability Resource Center in college, I mean, they can really let you know if that college has something that you need to know about, or do you need a reasonable accommodation? And the universities have that too. Again, Google vocational rehabilitation for your city and state. Often they can even help you pay for something that helps you go to school or go to college. Some have even paid for an adaptation so you can drive independently, but they are going to tell you if there's a need for in your city for the job you want to do. And they might say, yeah, New York City, we don't need a lot, but in Buffalo, they are hiring a lot of these, skills. So vocational rehab is another good resource. There's also gottransition.org/resources. That's GOT transition.org for youth and young adults and parents. It has information on SSI and ticket to work programs, going to college if you have a child with that condition, and many other resources. I just don't have time to go into them all. There's an adolescent health transition project. They have transition resources and support. Luckily, you all are computer literate and know how to Google all these things. Healthy and Ready to Work National Resource Center has tools, programs, links. You just click under transition planning resources. So just Healthy and Ready to Work National Resource Center. Life Course Toolkit. I like that because some people just don't know what they want. I mean, some people without disabilities don't know what they want. So it helps individuals and families of all abilities develop a vision for a good life. And that is www.lifecoursetools.com. All abilities. Pacer, again, they don't pay me to say this. I just find so many good things for them. They have a National Parent Center, Lynn, for transition and employment. So they have information on building a resume, preparing to volunteer at work. And also, lastly, talk to others about how they found a job, be positive, and keep moving forward. You can always change your mind. Remember, knowledge replaces fear. So I just recently retired, but I will send my notes to Meredith in case somebody wants the information later. Thank you for listening. It's truly a pleasure talking to you, working with the team, my friends.
Thanks so much, everyone. Any last words of advice before we sign off for today? I do want to thank everyone for participating today, and especially thank Meredith for bringing it all together.
Thank you so much. It's my pleasure. And thank you all so much for taking the time to speak and be here. It's just been so neat to hear all the different perspectives and views today. And thank you so much, Lynn, for helping me with this panel and co-moderating with me. And thank you so much to everyone who's taken the time to listen to us online today.
Thank you.